Hello. In the last video, we spoke about diarrheal illnesses. We spoke about acute diarrhea and chronic diarrhea, and we listed the myriad causes of diarrhea that exist. Today, we're going to talk about prevention, and we're going to discuss how doctors treat diarrheal illnesses. As far as prevention goes, we know that most diarrheal illnesses are caused by infectious agents. And we also know that the majority of those infectious agents that cause diarrheal illness are to be found in the bowels of infected people and in the bowels of animals. It's therefore easy for us to prevent diarrheal illness by avoiding these sources. And these sources cause bacteria and spread bacteria and viruses and parasites through fecal particles, and these fecal particles can find their way into the food that we eat, into the water that we drink, and on the fruit and vegetables that we consume. Therefore, it is simply a matter of us avoiding dirty, contaminated food that is improperly cooked, food that is left open. You go to a street vendor stall and the food is open and flies are walking on the food. This is the type of scenario that can easily cause diarrheal illnesses. Water is also a source of diarrheal illnesses because in some countries where sanitation is not developed adequately, fecal matter easily finds its way into the drinking water and into the water that is used for cooking and for bathing as well as drinking. So that in these situations it is important for us to make sure that all the water that is used in the preparation of food that we eat is clean water, and that all the water that is used to wash the vegetables in the salads or to wash the fruit that we eat is water that is either boiled or treated or filtered. If we drink water in any situation like this, we should either choose bottled water or make sure that the water is adequately filtered or treated with iodine or with chlorine. People around us who use the bathroom, we should make sure that they wash their hands, especially if they prepare food. And people who change baby diapers should wash their hands. Make sure that they wash their hands after they change the diapers on the children, because this could be a source of contamination as well and lead to diarrheal illnesses. Now, prevention is not limited to avoidance. Prevention is also possible through the use of vaccinations. Unfortunately, for travelers going to less developed countries, vaccines exist today for salmonella and for cholera, and you can take those for 1 or 2 weeks, 1 or 2 weeks before you leave, and be protected when you go to the new country. Although protection is not 100%, we still have to be vigilant, and we still have to be careful and make sure that the water and food that we consume does not cause diarrheal illness, is not contaminated. Now, vaccines for rotavirus also exist, and many countries have recommended rotavirus vaccines for infants so as to protect them from rotavirus diarrheal illnesses that are pretty common in daycare centers and kindergartens. Now, what about treatment? The leading cause of death in diarrheal illnesses is loss of fluid and subsequent severe dehydration. And because of that, the World Health Organization and UNICEF have recommended the use of oral rehydration solutions for rehydration of children and patients suffering from diarrheal illnesses. The introduction of ORS, or oral rehydration solution, has had a profound impact on the mortality rate of diarrheal illnesses in the world. In cases where ORS is not available, we can formulate our own solution by using half a teaspoon of salt with 6 teaspoons of sugar in 5 cups of water, clean water. 5 cups of clean water is about 1 liter of water, and the water should be either boiled or it should be treated adequately or filtered. Now, in other cases, we can treat diarrheal illness, we can shorten the duration of the illness by using loperamide. Loperamide is a medication that is sold over the counter in many countries of the world, and that inhibits the contractions of the bowel wall. This decreases the transit time of the secretions and the fecal matter, and it cuts down on diarrhea and shortens the duration of the illness. Loperamide is, however, not indicated in every single type of diarrhea, and inflammatory diarrhea with blood in the stool, fever, abdominal pain should not be treated with loperamide. Beyond this, loperamide has also been shown to increase the incidence of a specific type of renal failure that occurs in children who are infected with certain types of E. coli, so that loperamide would not be used in patients with this type of diarrheal illness caused by E. coli. Apart from loperamide, other drugs such as racecatrol, which is a drug that is sold over the counter in many countries of the world. It is an anti-secretory drug that prevents the secretion of minerals and fluid into the bowel. This too has been found to be very effective in all types of diarrhea. And racecatrol is better tolerated than loperamide, and it also has less side effects. So it is a drug that patients prefer. Loperamide frequently causes rebound constipation, and this is a problem in patients, not to mention the fact that loperamide in some cases interacts with other drugs. In some cases, zinc has been used. Studies have shown that zinc in children decreases the duration of diarrhea, and zinc also prevents future diarrheal attacks, future cases of diarrhea in children. For that reason, zinc is routinely used and recommended by the WHO in all children with diarrheal illnesses below the age of 5. Zinc is a mineral that is an essential trace mineral in humans, because the body does not need large amounts of it, and this mineral is important for tissue repair and for the immune system, and it's also important for the transport of fluid and minerals across the bowel wall, so that zinc supplementation is important in diarrheal illnesses, at least in children so far. Antibiotics are sometimes used in diarrheal illnesses. Although we know that most diarrheal illnesses are caused by viruses, some cases such as Shigella, Salmonella, and C. difficile that I mentioned earlier are susceptible to antibiotic treatment, and antibiotics are frequently used for these infections. As in cases of protozoal infections, parasites such as Giardia and Cryptosporidium, and in some cases of amoebal infection that is causing diarrhea. Herbal remedies have been used in some cases, and in other cases people have used probiotics such as Lactobacillus and Saccharomyces have been used and have been shown by some studies to be effective in diarrheal illnesses. As far as feeding goes, it is important to continue eating during diarrheal illnesses, and it is also important to continue feeding children and breastfeeding infants during the oral rehydration phase of diarrheal treatment. In cases where diarrhea becomes extremely severe and there's profound nausea, profound vomiting, severe dehydration, intravenous fluids are used to rehydrate the patient and nurse them back to health. Now, in the case if a patient develops severe symptoms such as blood in the stool, severe protracted diarrhea, profound dehydration, mental status changes, or weakness and debility, patients like that need to be taken to the emergency room as soon as possible. Now, I'd just like to remind viewers that this video is not intended to diagnose or treat any illnesses, and any topic that is discussed here, any treatment or any treatment that is similar to treatments that we discuss in the videos, should be discussed with your personal private physician before utilizing any of these treatments. Please leave your comments below and I will discuss them in a future video. Thank you.